Good afternoon, Senators. It is a pleasure to be invited to speak here with you today. My name is Emily Gruenwoldt, and I am the CEO of Children's Healthcare Canada. I am also the Executive Director of the Pediatric Chairs of Canada. We believe that while kids have been among those least likely to fall seriously ill because of COVID, Canada's children and youth have been the most affected by our response to this pandemic. As many of you will know, earlier last month, Children's Healthcare Canada, the Pediatric Chairs, and Canada's Children's Hospital Research Institutes submitted a proposal to the federal government urging emergency funding to expedite the rollout of virtual healthcare services in hospitals and within the community, as well as funds to sustain the child health research enterprise, heavily impacted by the economic slowdown. These recommendations were endorsed by the Canadian Pediatric Society and their 3,400 members across Canada. Collectively, we are pleased with the government's initial response to both requests. We continue to work with federal officials, as well as Canada Health Infoway and the Canada Research Coordinating Committee, to ensure children's providers and researchers receive an equitable allocation of this funding. Today, however, I would like to focus my time speaking to how COVID-19 continues to impact the health and wellness of children and youth across Canada, and the role for the federal government to build back better. That is, to facilitate a nation of healthy, vibrant children and youth. Last week, Children's Healthcare Canada surveyed 60 executive physician and administrative leaders of Canada's children's hospitals, our community hospitals, children's treatment centers, and home care and respite providers. We also surveyed our family network, which is comprised of over 100 family partners. In addition to continued support for the implementation of virtual care and funding to sustain Canada's children's health research community, two clear priorities emerged: enabling access to essential healthcare services, including addressing the backlog and wait times for elective procedures, and facilitating the return to school for children and youth. I will address both these issues in succession. It has been 11 weeks now since the most non-urgent and elective procedures abruptly came to a halt in hospitals across this country. At the same time, many essential services delivered in the community or the home were also shut down. While the virtual delivery of some of these services provided an important stopgap measure, the time has come to facilitate the reopening of these services for children, youth, and their families. The capacity of our health systems to thoughtfully and safely ramp up these services in the days and weeks to come will be critical to reducing morbidity and ensuring positive health outcomes for Canada's children and youth. Dr. Andrew Link, the Chair of Pediatrics at Dalhousie University, has observed the focus on the backlog of services in the adult care sector, but worries the same attention has not been given the impact this shutdown has had for our children. If we want to mitigate the negative outcomes associated with delayed or deferred services, or the related wait times patients and their families are now experiencing, we will require additional federal resources to bridge the gap, allowing children's hospitals to operate at a higher capacity than which is possible with current operating budgets. It is estimated that children's hospitals will require up to a 20% increase in resources to address the growing backlog of non-urgent and elective procedures. Beyond surgical and elective procedures delivered by our children's hospitals, many children and youth and their families continue to experience significant gaps in services. The majority of in-person visits have been postponed for children with medical complexity, as has their access to community-based services, including speech-language pathology, physical therapy, occupational therapy, and social work. While the disruptions were an inconvenience in the short term, many families now fear their children are experiencing an irremediable loss of functioning and are observing significant behavioral challenges, in particular in children with neurodevelopmental diseases. Families of children with complex impairments, developmental challenges, and disabilities are also struggling with decisions around the continuation of home care and respite services. Many have canceled nursing services because they're worried about increased infection risk from individuals coming in and out of their home, while others simply do not have the space to accommodate home care workers or those providing respite during this time when parents and caregivers are working from home. In some instances, parents and caregivers have had to forego employment in order to care for medically fragile children, putting additional strain on their family. Further complicating matters, reflects Jennifer Churchill, the CEO of Empowered Kids Ontario, is the fact that staff at child development and rehabilitation centers who are preparing to resume in-person services face a childcare crisis created by the pandemic that threatens to undermine our ability to deliver services, including virtual, and the reopening of local economies. Public schools are closed in nearly every province, and many camps will not open this summer. Childcare providers remain closed or open only for designated essential workers. The informal network of relatives and friends that many of us rely on for childcare has collapsed in this world of social distancing. The role for the federal government, working in close collaboration with the provinces and municipalities responsible for public health, include sourcing a reliable supply of personal protective equipment for health professionals, young patients, and their families, enhancing testing and tracing capacity to facilitate the reopening of our essential healthcare services, ensuring adequate infrastructure to facilitate delivery of virtual care where appropriate, facilitating the reopening of childcare spaces to enable the return to work for health service providers, and importantly, funding to increase hospital capacity to increase the backlog, to address, the backlog of elective services. The second issue I would like to quickly address is the return to school for children and youth. As evidence evolves internationally, we are developing a better understanding of the relationship between children and the coronavirus. While the pediatric community watches closely the developments associated with multi-system inflammatory disease in the context of COVID, the research still tells us that children are less likely to contract coronavirus. Researchers at Great Ormond Street Hospital in London, England, have found that children appear to be 56% less likely to contract the virus than those over the age of 20, a finding that supports the idea that children are unlikely to play a major role spreading the disease. In fact, the balance of evidence to date suggests that children are the safest group to be out in the community. They have the lowest prevalence of infection, and the risk of death or severe infection from COVID remains exceptionally low. Many of Canada's children's hospital leaders agree and favor a return to school given the well-documented impact of social isolation due to physical distancing measures. Dr. Ronnie Cohen, the CEO of Sick Kids, believes we need to accept this virus will stay with us for a long time and learn how to live with the current situation. We must reduce and mitigate risk as much as possible, yet acknowledge that we won't be able to eliminate the risk altogether for some time. Dr. Kathy Bigsby, a pediatrician in Charlottetown, Prince Edward Island, and a board member of Children's Healthcare Canada, states, we must address the risks to healthy physical and mental development of children in the face of prolonged school and camp closures and home confinement. Children are missing out on the critical social interactions with friends, classmates, and teachers that are essential for their healthy growth and development. This perspective is echoed by Kathy McNeil, CEO of Vancouver Island Health Authority, who shares the risks of mental well-being of children and youth are compounded by the stress of an ongoing pandemic and changes in their routine and structures. As schools work to reopen across Canada, we must not overlook the necessity to make available mental health resources, whether face-to-face or virtual, in particular for our vulnerable youth. For Canada to successfully reopen their schools, the health and education sectors must work together along with children, youth, and their parents to develop innovative policy and pedagogy solutions to enable a fulsome and safe return in September. These solutions need to be guided by community-level evidence and, where relevant, pan-Canadian and international experience. Special considerations and a unique strategy will be required for children with disabilities, medical complexity, or other vulnerable children, a strategy that must be co-designed with family partners. The federal government has a leadership role to play. We require, yet again, enhanced testing and contact tracing. As children return to school, we must have the capacity to monitor the spread of this virus with vigilance. We also require financial support for the education sector to develop and implement a strategy to ensure a safe and learning environment for all Canada's children and youth. In conclusion, Children's Healthcare Canada and the pediatric chairs believe that children have been the silent victims of this COVID pandemic. Earlier this spring, UNICEF released a report that recognized the unprecedented impact of COVID-19 on the lives of children and youth. There has been a perception amongst many that because children are less likely to experience severe symptoms, they are less affected. We know this not to be true. The next several weeks and months will be defining times for all Canadians, including our children and youth. Children and their families cannot afford to wait months or years for essential health services, including surgical procedures, outpatient therapies, or home care. Nor can they afford to wait months or years for school to return so that they can socialize with their friends and learn in a safe environment. Children are by nature resilient, but the time has come to implement solutions to ensure their health and well-being. Canada's federal government, working in close partnership with the provinces and municipal counterparts, play an essential leadership role in this COVID recovery, and more broadly in the delivery of compassionate, safe, and effective healthcare for all Canadians. Let's not lose sight of the burden this pandemic has had on our children and youth and our responsibility to build back better.